Monterey County Public Health Laboratory has been here for over 40 years. We're one of around 23 local public health laboratories in the state, and we are part of the Laboratory Response Network. So it's a whole conglomerate of laboratories that makes up the public health infrastructure for California. We actually train year-round for emergency testing. So we are actually sent unknown specimens representing, the bioterrorism agents, the norovirus, the enterics, and we're tested year-round to ensure that we can accurately identify these causative agents in a timely manner.
Before COVID, the laboratory, we focused on, some of the main organisms that were organisms of public health concern. So, TB, valley fever, pertussis, those type of organisms. We'd receive specimens from our local hospitals or from our outbreak nurses, from our communicable disease unit or our TB unit.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
We, like everybody else, heard about COVID, through the news. When we found out it was a coronavirus, that actually concerned me greatly, because coronaviruses, they're highly transmissible, and they mutate constantly.
When the pandemic was emerging, we began preparing. So we began preparing. Okay, what do we need? What supplies do we need to be? How big is this actually going to get? If it does get big, what kind of supplies do we need to have on hand to be prepared?
And so, early on, there was talk about it maybe not being as bad as the flu virus. But I thought, well, if it's highly transmissible, this is going to be a problem. And so we started ramping up early on before other laboratories. We started ordering the lab supplies, the gowns, but what we didn't have was the test. And at that time, at the very beginning of the pandemic in the United States, CDC was the only one that had an authorized test for COVID. And they were only giving out their tests to certain public health labs that were already in their system for doing influenza surveillance. And we were not part of that, and so we had to get in the back of the line. I was feeling a lot of pressure because we were the only laboratory in Monterey County that could do COVID testing, because we have the equipment, the same equipment that's used at CDC, and we have the training to be able to do the high complexity PCR testing that was needed to do the testing, and the facilities. We are the only laboratory in the county with 2 bio-level safety 3 suites, which are specialized negative air pressure rooms that allows us to work with highly contagious agents.
Then the pandemic hit, and it changed everything. That consisted of receiving specimens and processing them so that we can extract the RNA, extract the genome of that virus in that specimen, and be able to detect if it's there or not. And that consisted of working inside the BSL-3 suites. That consisted of being a lot on the bench, working late hours, working long days, but it was great.
The training was amazing. There was a lot of micros, even other laboratory assistants, the senior micro, Donna, they prepared us. And the training took weeks, just for us to be very efficient in our work.
We started testing on March 5th, I believe, but even before that, we were getting specimens from the hospital. and we were shipping those to CDC. So that's another area of expertise that we have, because, you know, if you're dealing with an unknown agent, there's a special way of packaging and shipping it, and that's something that we're trained to do. So we were doing that for about a month, maybe 2 months before testing in-house. And when we started testing, I think we started out maybe doing a maximum of 20 tests per day. We started out with just the 3 microbiologists doing the testing.
It was very difficult. Like, we were getting hundreds of specimens every day. It got to the point where we even asked or took in a lot of people to just help out, even student interns, which, you know, we're really grateful for, but it was a difficult time.
I did an interview on NPR, and there was a grad student from Stanford who heard about our need for additional, you know, testing personnel. And so he emailed me and volunteered his services, and I was just so excited, because the type of testing that we do, as I mentioned, is, you know, it's similar to what's done in research labs. So these grad students were just perfect. They were, you know, ready to go, easily trained to start assisting. And so with their help, we were able to go from testing about 20 to 40 a day to about 100 to 200 a day, which was a significant improvement.
This is both a story of local journalism powered with students in the area who want to help, and then a public health department that was flexible and responding as best they could. So yeah, I heard a news story about sort of worries about testing capacity, and knew that myself, along with a number of other colleagues in the area, we had the skill set in order to perform some of these tests. Now, normally we work on very different things, but it turns out DNA and RNA are similar across all different types of animals, so we could sort of run those similar tests. Yeah, it was really great getting to work in the public health lab. I think it's an incredibly dedicated group of people. I think that's one of the things like that I will remember the most, is just how hard they work, and how underappreciated probably they usually are. And so definitely, as a voting member of society, it makes me feel like we need to continue to invest in the public health system more. But yeah, just a really great opportunity to get to work with them and assist in a small way, but just, yeah, as maybe Jose was saying, feel like at least we could do something in the midst of feeling pretty helpless about the situation.
I'm a fifth-year graduate student at Stanford over at Hopkins Marine Station. Just being home and stuck there for a while kind of made me feel useless, and I knew that I could help even just doing some data entry. So I reached out to Donna, and it was good. I really enjoyed my time there. Working with patient samples was super interesting, and I really appreciate Donna giving me the opportunity to do that. Just getting some inside scoop as to how it is that you go from swab to results in a day seems super fast and just super fascinating to me. So I really appreciate just getting some of the insights there.
It's been really great. I, like the other students, have mostly been working on marine systems and mostly working in like ecology labs. So it's been a really great experience to get some experience in a totally different type of lab, and also just see all of the work that goes into processing these COVID tests. When the pandemic started, it was a really scary time. And I think for me personally, it was nice to just have some purpose and, feel like I was using my time in a way that was helpful. So I really appreciate the opportunity. And yeah, I'll be continuing to work part-time with the public health lab through the next semester.
Originally, I was taking some summer classes during the pandemic to get a minor, because the school offered a minor during the time. And then I was looking for something to do after I got my minor, because obviously I don't just want to sit around at home all the time. But my mom mentioned that a woman she knew who worked at CHOMP knew that the laboratory needed volunteers to come help out with the COVID response. So I said, sure, I've got laboratory experience from school. I'm sure I could lend a hand. So I sent Dr. Ferguson an email just saying, hey, I'm a graduate from Cal. I've got some lab experience. If you need an extra pair of hands, I'm willing to help out. I've done a lot of work helping process the samples before they get tested, so making sure that everything we get isn't a biohazard, like it's not leaking in the bag or couldn't expose anybody to anything. We get all of our labels set up so that we have it ready to go in our information system, so that once we're ready to report out, we can just assign, we've already got a patient assigned to a number, so it's easy to report out to the hospitals. I'll also help with other miscellaneous things like keeping stuff stocked, making sure the reagents are all good, none of them are expired. If stuff's expired, throwing it out so we're not testing people with expired equipment. Just a lot of the, I suppose, preparatory work and helping make the microbiologists and assistants' lives easier.
When I was in school, we'd always hear about the different outbreaks and different, learn about the term pandemic, endemic, epidemic, things like that. And so, in my head, going through my training in college and all that stuff, I always thought it'd be really cool to work in an epidemic or an outbreak, but I never thought it would be to this level of this pandemic.
The pandemic was very stressful. It was very stressful on everybody, and everybody had the same goal in mind. So because of that, it was manageable. So you could look over to your coworker on the bench. They're just as tired as you are. They don't want to hear you complain. So it was very stressful, but it was okay because we were honored to have a role within the pandemic and to support our community.
I look back with a little bit of PTSD, honestly. Yeah, because it was such a stressful time. But I also look at the staff, and how hard they worked. We were working 7 days a week, 10, sometimes 12 hours a day, and some of us without a day off for 2 months. We worked straight. We look at the test numbers, like we tested around 61,000 specimens. That's a huge deal. That's 20 times more testing that we normally do in a year. I think we saved lives in a huge way.